Okay, Dr. Miter. Good afternoon, good afternoon, good afternoon, good afternoon, everyone. Welcome, 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 welcome. Wow. Glad to see you on a Monday afternoon. My name's Michael Miner, and I am the National Director of the National Baptist Convention USA Incorporated Hope Health Ministry, and I'm excited for you to join us today on our Midwinter Board webinar. Do we have a great webinar planned for you today? So look, let's just pause quickly. And why don't you go to our Hope Facebook page and share it in your Facebook group. We want to make sure that people can hear and this great information we have to share on today. We also are re-streaming on our YouTube page as well. All right. Look, we want to begin by acknowledging our president, Dr. Jerry Young, and our General Secretary, Dr. Alvin Edwards, the chair of our Federal Faith-Based Initiative, Dr. Alvin Love. And I am excited for the 11th year to be our convention's liaison to the U.S. Department of Health and Human Services. Well, in today's webinar, we will have a virtual meet and greet with Dr. Q English, the new director of the HHS Center for Faith and Opportunity Initiatives, as we affectionately call it, the Partnership Center. All right, we're excited about that. But before I introduce Dr. English, I want to remind everyone listening about the COVID-19 vaccination. I know it sounds like a broken record. So at first, we're telling you to get the vaccination. Now we want you to take your booster. Yes, take your booster. I've had my booster, and I'm telling you, I still have 5 fingers on each hand. And also, let's wear our N95 and our KN95 mask, and so that we can go ahead and help the Biden administration and our nation beat this COVID-19 pandemic. All right? And look, if you've already done so, why don't you share with somebody else and tell them they need to do the same? All right, so let's get started. Our special guest today is Dr. Q English. She is the new director of the U.S. Department of Health and Human Services Center for Faith and Opportunity Initiatives, the Partnership Center. As a coalition builder and network strategist, she served as a deputy director of faith-based initiatives for the New York Governor's Office of Faith and Community Development Services. Here she identified opportunities for the state of New York and HCR to elevate strengths and identify new opportunities to build relationships within the faith community. She also conceptualized and was instrumental in forming the faith-based office in the office of the mayor of New York City. She has brought together several roundtable and interfaith coalitions to create and implement strategic plans to tackle New York's most problematic issues. She is the founder and past president of Not On My Watch, an organization formed to combat human trafficking and domestic violence through education, training, and community and policy advocacy. Named one of 25 most influential women in the Bronx, Dr. English brings to HHS a wealth of knowledge in working with the criminal justice system, substance abuse issues, health and mental health, human health, domestic violence, HIV/AIDS. She has so much I'm stumbling over. Wow, civil rights and more. She received her master's and doctorate degrees from New York Theological Seminary, where she was the recipient of the Excellence in Ministry Award, the highest award given to a graduating doctoral student. Ladies and gentlemen, Dr. Q English. Dr. Q, welcome, welcome, welcome.
Thank you so much, Dr. Miner. Thank you for that incredible welcome. I just want to take a moment to acknowledge the National Baptist Convention USA's, I know President in his absence, Dr. Jerry Young, but thank you to the National Director of Hope, Health and Human Services Partnership, Dr. Michael Miner, for your leadership. I mean, NBC has been an integral part of the All of Us campaign, who aimed to increase diverse community in research, doing evidence-based research and education and more. And thank you, though, for your continued, and I might add, outstanding partnership with government. And you're a real leader in this space. And, you know, as I've been briefed and we've sort of gone over the records over the years, you set a national model in being in this space as a research and evidence-based programs is showing that faith-based communities can deliver on evidence-based programming. And so thank you. I just wanted to give a shout out to NBC right now. So I do know you wanted me to talk a little bit about myself and my background.
Yeah, well, good. Look, this, she can tell she's a preacher. I just told her that, I wanted to share about herself, but she had to give a shout out to me. So I appreciate that. I want y'all to know that I didn't pay her, but I can't put a check in the mail. But Dr. Q, look, you come with so much experience. Look, could you just take a moment and just share? Look, especially with some of the younger women that are watching, talk about your career.
So great.
Such a dynamic way. So share about yourself first, okay?
Thank you. I am excited about being a part of the team at IEA. I do have an extraordinary leader, Director of Marvin Figueroa. So as you heard, I did come to you as New York State's former Deputy Director of Faith-Based Initiatives in the Governor's Office of Faith and Community Development Service, but it did not start there. I've really been in the health and human services businesses all of my life, working with very highly visible issues facing our nation, such as HIV/AIDS, was then with Deborah Fraser-Howe when she launched the National Black Leadership Coalition Against AIDS. I did a lot of work in the substance abuse disorder field and health and mental health, which is plaguing our Black community. I've done a lot with women and girls issues, as you heard, around domestic violence and human trafficking, forming the only people of color-led organization combating human trafficking and domestic violence through education and training, and community and policy advocacy, always on the front end of racial injustices. I used to get arrested on Martin Luther King Day. So I am definitely one of those outside the four-wall pastors standing on the podiums and being at press conferences with whomever, as long as there was an injustice around, I was ready to get arrested, and that was fine. Worked a lot on the criminal justice reform and, of course, COVID-19. And I've built coalitions and networks through New York. But I do have to say that, and one of the flagships have been, launching the first People's Police Academy. It was heralded as the first model, not only in our city, but in our nation by the past commissioner. It's an academy which is led by the community to educate officers in communities they serve, but not necessarily live. So we got a police academy, but we needed a People's Police Academy so they can understand the dynamics and how do we build that bridge between both entry. And so I worked on reentry and mentorship programs for probationers and more. But what's important that I think more important is that I not only come from the four walls, but the grassroots to lived experiences. When my brother died from opioid, heroin, and AIDS, two sisters, HIV/AIDS positive, suicide among family members. It was my older brother you would pass on the street with a shopping cart full of whatever he felt needed to be in there, and dismangled hair, and occasionally screaming from the backside of a building due to untreated mental illness because of our horrible statement that we lived with in the Black community, which was what's went on in the house stayed in the house. What goes on in the house stayed in the house. One of the worst guiding phrases used in our Black family homes, and perhaps he could have got help, but to a father who received a Purple Heart as a veteran. But with that Purple Heart came severe PTSD, where our kitchen cabinet was filled with more pills than dishes. So I come with lived experiences. I come from lived experience and operate through my lens as a faith leader, as a God-fearing woman. And one of the principles, if I'm going to talk to my young girls right now, my young women right now, as a Black woman, is basically understand that no man controls your destiny. And there's two questions you have to answer in life. And one is, what is it you're willing to live for? And the other is, what is it you're willing to die for? And until you answer that second question, you haven't truly lived. And how do you find your passion? One is you got to understand what angers you is what you're assigned to solve, and what saddens you is what you're assigned to heal. Create that marriage, and then you'll be on your path of destiny. And I'm going to leave that just because you asked me that. I know you're going to ask me that, but I love talking to my up and coming women of color. And absolutely, but not least, and I'm going to turn it over to you. My husband and I pastor Bronx Christian Fellowship in the Bronx. That's why I'm honored to serve you in your community as in my new role as a director of health and human services.
Oh, my goodness.
Thank you.
I'm hoping that Sister Ellen is watching this for our millennials. I tell you, you're just definitely inspiring. You all got to meet up. All right. Look, let me go and ask a few questions here about the Partnership Center. What do you see your role? We know I've been involved in the Partnership Center now, I got 11 or 12 years, and I've seen it go different iterations. So how do you see your role with that? And then tell us just a little tidbit about what the Partnership Center is doing. I mean,
okay, that sounds great.
Tell what President Biden, put the name of the president, what President Biden's vision is for the Partnership Center. There we go.
Okay. Well, the Partnership Center does fall under HHS, under Secretary Xavier Becerra, and right under Secretary is my IEA Director, Marvin Figueroa, and then I'm right there under Marvin Figueroa. And so we do follow through the lens of his directives. But, what we've done and will continue to do is connect with faith and community organizations to address national public health and public service issues. We do support the priorities of the Secretary, as well as you said, the administration. So we're going to continue throughout this year on our collaborative work on addressing, COVID-19 prevention and vaccine promotion, which I'm trusting will have an expiration date of that intentional, strong movement that we will come to a point where it may not be totally gone, but where it becomes to a place of being manageable, right? And so we're trusting that will happen. So we're going to continue our collaborative work on addressing, strengthening child and youth well-being, improving addiction treatment and recovery, and reducing healthcare disparities. We've accomplished a lot, over the years. I think the difference is that I'm coming not only as a director in the administrative sense, but I'm also coming as a faith leader, a fellow faith leader. And so with that lens, it's important for me to do, and everyone knows that we are going to increase stakeholders and partnership engagement among our Black and Brown communities. We are going to see that some of the resources that have been left off the table, we're going to continue to escalate that among our Black and Brown communities. And there's some specific pieces that I have created as far as our focal areas, and what I call our strategic plan for 2022 and moving forward. And it's very important. So, in addition to the Partnership Center working to address overdose prevention strategies with our faith and community partners and more, I am actually forming directors' think tanks. And the reason why that's important to me is because I come from grassroots. I come from the ground. I'm raised in Spanish Hollow with the bacalitos and arroz con pollo. My mom is still living in the projects on in NYCHA. And so for me, it's important that I keep that grassroots a connection even more intentionally. Even though the Partnership Center, we work regionally, we work with the grassroots organization. What I'm adding to that is that I'm having think tanks around me on the areas that we're going to focus on, and we're going to have them as a place of talking me through best strategies, talking me through some of the things I need to pay attention and to be aware of. So if it's a good time now, Dr. Minor, I'm going to just talk about what we're going to adopt moving forward that affects our communities. One is maternal health.
Quit reading my mind. You just got me lined up about those think tanks and things. You got my tank thinking. So you worked it out there. I look and things blowing up. And look, I want y'all to know we're gonna cut off on social media at about the 40-minute mark, but we're gonna continue on Zoom. So go ahead, Dr. Q. I'm gonna cue you up. Go ahead.
You're part of my think tank, Dr. Minor. I need you and some of these other folks that are on this call to say, hey, these areas permeate with me. And more importantly, you've been in this work for a very, very, very long time. And not just been in the work, has done an incredible job in this space. And so for me, I always come in a position of a learner, and I have to remain in that position in order for me to be effective. And so when I think about some of the initiatives that we are undertaking, one is maternal health. And that is supporting the goal to reduce maternal mortality and severe morbidity and expand nationwide access and coverage for high quality maternal health services. So we support CMS's encouraging of states to take advantage of the American Rescue Plan's option to provide 12 months postpartum coverage to people with Medicaid and CHIP which currently only covers 60 days. And why is this important? For one, the United States has the highest maternal mortality rate of any wealthy nation in the world. And so when we look at Medicaid and CHIP, they cover over 42% of births in the nation, nearly half of which are to Black, Hispanic, American Indian, Alaskan Native, and then 1/3 of maternal deaths occur between 1 week and 1 year after childbirth. That's why that 60 days isn't working. And rates are especially high among Black women. Yeah. It is the highest, let me be very clear, among Black women and American Indian, Alaskan Native individuals. And honestly, I can't but hear the words of Martin Luther King, who said all of the forms of discrimination and inequality, injustice in healthcare is the most shocking and inhumane. So we, along with our colleagues, want to ensure that the U.S. is one of the safest countries in the world of women giving birth. And so as part of the call to action, the Department of Health and Human Services released a new report estimating, and this is very important for you to hear, that 720,000 more people would gain Medicaid postpartum coverage if states act. So we will engage our faith community and network neighborhood partners on this front, providing support and connecting them to needed resources. I also want to see launched in our houses of worship, support groups, support ministries for those that are expecting children, and where we form ministries within our houses of worship to walk with these individuals for a year. So we as a center has made this one of our key priorities. Yes. And so, Dr. Mina, we can launch this as a pilot with NBC. I have a maternal think tank that I'm forming. We have a couple of calls coming up. And so in that space, we can start formulating how would that look?
Count us
in houses of worship. There's some, yay. That is so fantastic. I would love to spearhead that with you. And there's some models out there. As a matter of fact, I'm coming across curricula and just being able to package it and say, NBC, here we go. Let's pilot this thing in your houses of worship. So that's one of the focus areas that we're dealing with. Number two, we're going to expand our focus on include behavioral and mental health among youth. The mental health of children was declared a national emergency last year, and suicide is the second leading cause of death among youth. It's a priority of our secretary. In 2021, the U.S. Emergency Department visits for suspected suicide attempts soared by nearly 51% among girls, 12 to 17. And then it increased by nearly 4% among adolescent boys compared to the same data we had in early 2019. So we are definitely putting that as part of our major initiative of mental health in youth, as well as suicide prevention going hand in hand. Just as something that's coming, it's not even out there yet, but in July, we're going to be launching a new suicide prevention and mental health care hotline. That's going to be the sister to 911. It's going to be 988. And it's going to be tied to life centers across our nation, and definitely going to engage NBC as we start rolling this out so they can get the messages out to their houses of worship. I do have a think tank around here around this area as well. So we'd love for you to be a part of that. And then finally, our third focus area will continue to be that of substance use disorder, inclusive of overdose prevention. As we look at this third area, the Partnership Center had published, the opioid crisis practical toolkit, and they're going to be expanding that. There's a faith and community roadmap to recovery support, and Compassion in Action is a guide for faith community serving people experiencing mental illness and their caregivers. But we're going to produce more toolkits around our newest initiatives. In addition, we're going to translate into Spanish some of these existing. So I am expanding our Hispanic outreach. So we're having several conversations with the secretary, with Hispanic and Latino leaders, faith leaders, and we're going to continue to expand that across our nation. Again, COVID-19 vaccinations, boosters. That's a given. That's at our core. And Dr. Minor, thanks for giving that shout out. Yes, yes, yes. Let's get vaccinated up. And we'll continue our work with child well-being. And for those issues that may be best served by other agencies, Dr. Minor, we'll make sure we can make the connection there.
All right. Let me let you know right now.
Stop there.
All right. So Dr. Felisa Washington, I'm going to make her job much more difficult. She does the messaging for our social media for our monthly health services. We did not have a whole lot of good information, but I want you to know now that since May is Maternal Health Month, we're going to make a special emphasis also on that. And I know I'm stepping out on faith. I'm sure Dr. Young will give me permission for us to pilot and share that. We'll get with you and Dr. Felice will work together and get that done. We want to make sure.
Yay, so great.
We talk about Mother's Day in May. We want to do that. And look, for our pastors on here, I like the idea what you said. Can you adopt a mom for a year? I mean, I'm using the word adopt, but just walk with them.
Love that.
Walk with them for a year. I heard that. Can we walk with our new mothers for a year? So I'm just saying, yes. I'm laying it out there. Can we walk with our mothers for a year? We got some state convention presidents on here. But anyway, we got so much to digest on that. We're going to move on. This is the thing I want to get to because they're always going to ask, look, the big question, how can NBCUSA churches get involved?
Whoa, what? The better question is, how do we stay away? Because you're talking to a fellow faith leader about to tell you how to get involved. But there's several ways that everyone can get involved. And that is staying connected to us, saying that, hey, I would love to be a part of your think tanks. Number 3, talk to us. Let me know what's missing. What am I missing in this conversation? And for me, it has to be a two-way conversation, unless it's not a conversation. I'm not into being just a talking head. I love hearing ideas that come from spaces such as NBC. I want you to keep me informed of things that's happening in the health and human services. I want you to tell me when there's hiccups in your community. I want you to tell me, hey, they got access to it, but we didn't get access. We need to be proactive in this space. And when I tell you I am committed. And, the people that know me is like, my word is my bond. I like to be known that my word is stronger than a piece of signature on a piece of paper, and it's stronger than my handshake. So I definitely want you to know that if it's in my power to do it, I will do it. And also, I want you to know that I'm present, right? And my goal is to build stakeholders and partners as we move together as a center, increasing stakeholders and partners in the Black and Brown space that are service providers and or, boots to the ground, CBOs, working as nonprofits. And while we don't have money, particularly to write a check directly to you, we do have the inroads to keep you informed of grants that are being released from government. In addition, we have capacity building, and the capacity building is about how do I get in position for this? What are some of the things I need to think about? I was a nonprofit. I formed my nonprofits along the way, and I understand the challenges. But how did I get in position to get a grant? What did I have to do in the partnership base to be taken credibly, even as a new person? It's different with federal. So we have capacity building on that. And there are monies out there, but it doesn't necessarily mean just because you ask for it, we're going to get it. Now, let me just be totally transparent with you. There does have to be track records. There does have to be partnerships. And there has to be data tracking, right? Mm-hmm. A lot of times we don't do that. We say, oh, yeah, we just fed 100 people yesterday and we did this the other day. We got to be more organized in this space where we think of church as a business and think of what are these other external nonprofits we're going to create, and how do we track our success? So that's a whole nother conversation, but I'm committed to knowing that. But if you don't reach out, I can't help you. If you don't reach out, I put my email in there. You can reach out through Dr. Minor. I definitely want to do things on a more of a collaborative basis. So my point person will be Minor on some of these big pieces, but I do want others to feel free to reach out, to tell me what's happening. who I can connect you with. Being connected to me just helps alleviate some of the cold calls, right? Some of the cold movements. Now I can just sort of like create an email connection that they can follow up with you coming from the director of the center. So that's it. I want you to be a part. I want you to be a part of my director's think tank efforts. I want you to keep me informed of things that's happening in the health and human services. I want you to tell me when there's hiccups. I want you individually to become partners in other areas by sharing your email and contact information. And again, my goal is to build stakeholders and partners as we move together as a center.
Woo! All right. Well, look, I'm gonna wrap up the first part here. That's gonna be in our social media. Thank you all on Facebook. My goodness, man, we got a lot of people watching on social media. And then for those who are watching later, that if any question you have, we always do our best to follow up on the comments, and we'll check the comments that comes into us, and we'll follow up on those, even if it's not on today. All right. Look, we want to do this. Let everybody know that we have been part of the work with the Partnership Center since 2010, 2009. And so we're excited about that effort. Okay. So look, everybody, we're going to get ready to wrap up the social media part of our session today. We want you to know that those who are watching on social media, be on the lookout. In May comes, we're going to do this thing on maternal health. That's happening. We're going to push that. For those pastors who may miss us, or those that are health ambassadors, we want you to think about walking with that new mother for a year. I love that. See how we can get that done.
Yes.
Everybody thinking that she's the money woman. Let me let you know right now, she's the person that can get you capacity building. Quick story. The Partnership Center told us about the Affordable Care Act and the funding that was available. They did some capacity building training for us. We went through it, but not everybody listened. And when we did do that, there were several of us across the country that were able to do it. They did not give us the money. Which y'all know that. They did not give us the money, but their capacity building allowed us to position ourselves so that we could be able to do it. And also because of capacity building, they put our denomination in the position to receive this $750,000 grant from the NIH. So what we're seeing here is the most important thing that Dr. English can give you is more important than money. It is capacity building, how to do, what to do, those things. If you're committed to that, the Partnership Center can help you reach higher and higher heights. Now, if you think you'll go in there and all of a sudden it's going to open up the windows of heaven and money going to rain down, please don't email her or call her. You wasting your time. But if you really want to go in and find somebody, can I be country, who going to help you to get to the next level? The Partnership Center. I'm not telling you what somebody told me or what I think. I'm telling you from experience what they're going to do. So Dr. English, you hold tight. We're gonna do our little wrap up for the first part, and we come back to look. So let's give a. So you know how to do it in here. Y'all can do your hands up in there and everything. Thank you, Dr. English. Thank you for social media. Hold on, let me do my little wrap up here. And so hold tight there, Dr. English in the background. But look, for everybody that's watching on social media, we do want to remind you that we have a series of regional webinars coming up. I'm gonna close my face for a second. A series of regional webinars that's gonna begin March 5th. We want you to participate in those. You can email info@hopenbc.com, info@hopenbc.com. We'll find you information about that. Dr. English says know that, but we're gonna make sure that in each one of these regional meetings that we say something about the Partnership Center. So we got March 5th, the Southeast.
That'd be great.
Is the Southeast. The 19th is Southwest 2. April 30th is Southwest 1. May 14th is the Northeast. And June 3rd is the Far West. We got a couple more we got to put in there, but email us. Each one of the regions, we have a workshop that's going to be specifically geared to your areas. We have our regional coordinators who are on today. And I'm going to announce the name in just a minute. But get in contact and we can talk to you about some of those things that's coming up. Those are our regional webinars that are coming up for 2022. Even though we're not meeting in person because of the pandemic, we are making resources available for you. Also remind you about our work with the All of Us Research Program. joinallofus.org/NBCUSA. I want you to go out there. If you hadn't done it already, we want you to be able to do that. This is an opportunity for us to be one in a million as we provide additional resources in the database. You know, for National Baptist, we're really pushing things around sickle cell. So if you haven't had an opportunity to go in and find out more information, do that. Why don't you join on that today? All right. We want to remind you all that January is Volunteer Blood Donor Awareness Month, Glaucoma Awareness Month. You know, February is big for us in National Baptist folks. That's because it's Wear Red Sunday. And, you know, some of y'all, it's on the third Sunday this year. And some folks said they weren't doing the second Sunday. But look, whatever Sunday, the second or the third, wear your red for Women in Heart Health and put your pictures out there on our Facebook page. And of course, the first Sunday in February is National Black HIV/AIDS Awareness Day. You can join us on social media. Our Facebook page is National Baptist Convention USA Incorporated Hope Health Initiative. Our Twitter feed is Hope_NBCUSA. And our YouTube channel is NBCUSA Hope. You can go to our webpage, hopenbc.com, and find out more information about us. We're going to put a webinar survey in the chat so you can provide us some feedback. We appreciate it. The biggest room there is the room for improvement. And we want to remind you all, we're part of the Midwinter Board meeting. We don't want to miss our president's perspectives tonight. So for those that have already registered and whatnot, you can go ahead and watch it on Brushfire. And also we're going to share it on our social media. We want to hear our chieftain, Dr. Young, gives his perspectives at the beginning of this year. Thank God for our tireless team. Dr. Desi Levy, who is also, in addition to being one of our volunteers in our overall health ministry, she's doing a very able job as our co-PI for our NIH All of Us research program. Sister Lottie Minor, I might know something about her. Sister Bettina Campbell, Pastor Dexter Moraney, Sister Ellen McKnight, Dr. Felisa Washington, Minister Geraldine Moore, Sister Loretta Miller, Dr. Lavora Williams, Sister Nettie Johnson, Dr. Marion Talley, and Brother Thomas Duke Robinson, who is handling our technology. And we're so fortunate now to have the world's greatest regional coordinators, amen, are doing a great job. They're building the plane, flying the plane, but they ain't crashed it yet, all at the same time. In the Northeast, Pastor Daniel Blackburn. The Southeast, Sister Brooklyn Rogers. Southwest 1, Pastor Bernard Montgomery. Southwest 2, Sister Linda Copper. Midwest, Sister Teresa Fales Farr. In the West, Sister Norma P. Jackson. And the Far West, Pastor Richmond Johnson. Thank God for all of our regional coordinators. Once again, we acknowledge our president, Dr. Jerry Young. He reminds us to envision the future exceptionally. This has been a production of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. God bless and God keep you is our prayer. This concludes the social media part of our session. And again, we'll follow up any question with you all later that are watching.